Over the last several months, our residents, businesses, and community have faced difficult circumstances with grace, kindness, and innovation. In Howard County, we continue to come together in collective action to support one another. Over the past few weeks, we've seen rising cases as we transition into immediate crisis with the colder winter months. This cause for mounting concern is tempered, however, with increasingly positive news about vaccines. Since the beginning of the pandemic nearly 9 months ago, we have made significant progress on mitigation efforts, including increasing our capacity and overall supplies. We overcame a broken supply chain and competed globally to secure more than 90 days of PPE. We have ramped up our contact tracing efforts, growing from 2 to 50 contact tracers since March. Today, it's appropriate that we're at one of our fire stations who have worked with private providers to stand up testing sites that are accessible to our community in Savage and in Elkridge. Compared to the spring, our testing volume has increased exponentially. Last week, we administered more than 13,500 tests, and that's more than double our initial goal of 6,500. We continue to manage this extraordinary crisis and focus on gaining tremendous insight to keep Howard County at the forefront of both health and safety. Today, we're announcing a bold, innovative leap in the progress to better understand the scope of COVID-19 spread among our population through serology testing. While diagnostic tests, many of us have received measure the presence of COVID-19, typically in individuals who may be currently symptomatic. Antibody or serology tests measure immune factors present after infection. Serology or antibody testing can provide a glimpse into the extent of COVID-19 infections in the recent past. And while we know today that having positive antibodies for COVID-19 does not necessarily mean a person is immune, serology tests are already providing us with very important and helpful information. Serology testing can be especially useful given evidence that many individuals who acquire the virus have mild or no symptoms. And so many, because they may be asymptomatic, might not seek out the COVID-19 diagnostic test or be accounted for through a healthcare encounter. The true prevalence of the virus in communities like ours is likely much higher than documented cases, and taking innovative actions such as our serology testing will not only help inform but also empower our community. Our serology strategy is three-pronged, beginning with our first responders, including fire and rescue services, police, sheriff, and corrections personnel, who were given the option to participate in the Maryland Department of Health serology study. This week, we are wrapping up our participation with nearly 600 responders tested. The results of this antibody test may indicate whether an individual is likely to have had previous infection with the virus that causes COVID-19, or if that previous infection may have caused unidentifiable symptoms. This specific group was selected based on the high risk for exposure to COVID-19 due to their work environment and job duties. Second, we are launching a government-wide serology effort so that members of our workforce, more than 3,000 people, can determine if they have COVID-19 antibodies. We know that the science continues to evolve, and we want to ensure that we understand all facets of this pandemic and are able to respond as effectively and efficiently as possible. Any Howard County government employee who wishes to participate can go to any Quest lab in Maryland to get their test. We're giving our employees the opportunity to have access to this test so they know whether or not they have COVID-19 antibodies. And finally, we are partnering with the Johns Hopkins Applied Physics Lab to develop and implement a groundbreaking serology testing plan to determine COVID-19 antibody prevalence throughout all of Howard County population. We will partner with other major organizations such as our public schools, libraries, community college to ensure their employees, staff, and families also get a serology test. As we know, things over the past few months have evolved quickly, including the technology to combat COVID-19. Thanks to incredible partners like APL, Howard County has had a front seat to emerging technology to mitigate the spread of this virus throughout our workplaces, businesses, and other public spaces. Our robust and comprehensive strategy to increase serology testing in Howard County can expand upon our understanding of how COVID-19 has spread through our community and puts us in a better position to make informed decisions moving forward. We are one of few jurisdictions across our great nation doing this work at this magnitude. And with our partnership with APL, we remain on the cutting edge of COVID-19 data and research. This year, we've relied upon scientists and doctors to guide our decision making, and now we have the opportunity to provide vital data and research to help our region and our nation, and frankly the world, better understand this virus. Our approach has always been data-driven and people-informed, and we will continue to search for innovative and efficient ways to mitigate the spread of this virus and ensure that our community is safe and healthy. Thank you.
Thank you, County Executive Ball. And now we'll hear from Medical Director, Dr. Matthew Levy.
Good afternoon, everybody. County Executive Ball, thank you for those. Good afternoon, everybody. Thank you. Right there. County Executive Ball, and to my colleagues in the Public Safety Leadership Team, thank you for your vision, your leadership, your compassion and dedication. This is truly a team effort and truly an all-hands lift as we've all come together towards combating and working through the challenges of the COVID-19 pandemic. I'd like to take just a brief moment or two to elaborate slightly on what antibodies are, and as well as what our public safety antibody testing efforts here in Howard County have been all about. Antibodies, as you can see from the visuals on either side of me, are proteins that the body creates in an effort to fight off infections. And indeed, they might actually be a very important role in terms of providing protection against future infection. Now, the presence of antibodies to the SARS-CoV-2 virus in the blood can indicate that someone has had past infection, and that even though they may or may not have actually fully developed symptoms. So that's very important and provides a really important amount of insight into the disease process. The scientific community is still continuing to understand what exactly the presence of antibodies means, as well as to what degree that could prevent or protect against future infection. It's important to note that we don't use antibody testing or the serology testing that we're talking about today to test for active disease, and that's because the body could take anywhere between 1 to 3 weeks to develop antibodies. And with that said, I think it's been already alluded to, but I want to just expand upon the fact that maintaining the safety and health of our frontline responders, of our first responders and public safety personnel, is both paramount to and needed to preserve the ability that we maintain to provide life-saving services to the people of Howard County. So over the past 3 weeks, we engaged, as the executive mentioned, in a voluntary and confidential testing process where we offered antibody testing to members of our public safety community. And as stated, nearly 600 of our public safety personnel, it's over a third of our public safety workforce here in Howard County, elected to participate. So that's really, really exciting and something to be very proud of and give us great insight into this disease process and its prevalence in the county. I will tell you today that our overall prevalence or positivity rate amongst that population was less than 2%. And while prevalence means right here, right now, at this point in time, that gives us a tremendous amount of information. Because that positivity rate was so low, we're not going to expand further on the details on subgroups because of privacy and confidentiality reasons of those tested. But I want everyone to understand today that access to this public safety serology testing program that we engaged in has really helped improve and provide greater insight, not only into the prevalence of antibodies amongst our public safety personnel here, but also gives us guidance about the policies and practices and procedures that we've implemented to ensure that we can keep our personnel safe, our responders safe, so they can continue to serve the community during this pandemic. We also welcome the opportunity for our mobile integrated community health program here in Howard County to assist in the larger efforts that have been outlined today. So I started off by saying that this is a team effort and that I'm very proud to be part of this team. And we will continue to do everything we can to use science, evidence, and data to protect the people of Howard County and our frontline responders who serve us. Thank you.
Thank you, Dr. Levy. And now to hear from Fire Chief Bill Anuszewski.
Thank you, Angela. Thank you all for being here today, and I welcome you to our Bethany Fire Station. As Dr. Levy alluded to, these tests indicate that our policies and procedures that we have put in place during this pandemic are working and helping to keep our emergency responders safe. Let me tell you a little bit of how this program first began. When we first started planning our efforts to respond to this outbreak in late last year, we really didn't know what we were going to face. We didn't know what personal protective was going to be adequate. We didn't know how we were going to respond, nor did we really know how the community was going to be impacted. Today, as we see the results of the serology testing, we understand that the decisions that we made early on are working. Our personnel are protected, they're taking the right measures, and we are able to continue to provide a high level of emergency service to our community. When this process was initially proposed as a study through the Maryland Department of Health, it was looking primarily as a study for fire and EMS service personnel. We quickly realized we needed to expand that group to include all of our public safety partners, as they have a significant public interaction or congregant interaction based on their roles in public. We further said, well, we can expand this more to include all of our county employees as an option for them to get tested. As you've heard, we have now successfully tested over almost 600 public safety personnel from across all emergency services. Now, more than ever, as we are in the midst of this surge, we have reminded all of our emergency providers, please remain vigilant, continue the use of our personal protective equipment, and continue following the recommendations of the CDC, and most importantly, take care of yourselves and each other. Thank you.
Thank you, Chief Anuszewski, and we'd like to invite up Police Chief Lisa Myers.
Good afternoon, and thank you to County Executive Ball for your unwavering support of our public safety personnel. As a first responder, our top priority is the health and safety of our employees and the community that we serve. We were glad to have the opportunity to join the fire department in offering voluntary antibody testing to our police officers. Many of them who respond to medical calls participated in this testing. They helped us confirm what we hope to be true, that our PPE efforts have been working. With a low positivity rate, we know our officers are taking the right precautions to protect themselves and the people they serve in our community every day. Our goal has been to keep our officers safe, which in turn ensures the safety of everyone they may come in contact with in the community. We will continue to be committed to following protocols and doing all we can to keep our first responders and all of the people of Howard County safe. Thank you.
Thank you, Chief Myers. We'd like to invite up Lieutenant Granger from the Sheriff's Department.
Thank you, Angie. Good afternoon, everyone. On behalf of Sheriff Harris and the Howard County Sheriff's Office, thank you, County Executive Calvin Ball, for leading this initiative on serology testing. Thank you, Dr. Levy, for coordinating this effort with Sheriff Harris and our office, and with our full support. This testing was another phase toward keeping our community safe, so prevention measures are working, and we continue to remind and ask everyone to wear your mask, wash your hands, social distance yourselves at all times. And thank you again.
Thank you, Lieutenant Granger. We'd like to invite up Sheri Lewis of the National Health Mission Area of the Applied Physics Lab.
Good afternoon, everyone. It is a pleasure to be here today to talk about this partnership between Johns Hopkins Applied Physics Laboratory and the Howard County government. This has certainly been a challenging year, but APL is honored by the opportunity to work with the county to make a positive impact on the health of the community the lab has been able to call home for more than 60 years. As scientists and researchers, we at APL know the role of good data in solving some of the biggest challenges. This study will determine antibody prevalence in the county population and involve the development of mathematical models to enable better understanding of COVID-19's reach within our community. Studies like this, which help us understand disease spread, are one of our most powerful tools. As we navigate through this pandemic, this study will give us greater awareness of the impact of COVID-19 on the Howard County population and allow public health officials to make data-driven decisions that affect us and our neighbors directly. In the last 20 years, APL has revolutionized the way public health professionals across the country access and utilize data in monitoring disease progression in communities. We are really pleased to bring the laboratory's decades of experience in using data to aid public health officials and support the county in protecting the health of our community. Thank you to Dr. Ball and the county for having us here today and for partnering with us on this very important work.
Thank you. And now we are here to open it up to questions from the press.
So I believe the doctor said that there was a 2% positivity rate. What is the positivity rate for the antibodies? Like how many of
Okay, to restate the question is there was a comment that there are less than 2% antibodies found to date in our population of emergency responders, and your question is, what is the larger population percentage of antibodies? Dr. Levy?
That's really a great question. It's one that we actually do not have the concrete answer to at this point. There are multiple studies underway that are trying to answer exactly what that question is of overall seroprevalence. To exactly your point, that's really part of the reason we're all here today, to better understand that and understand what that is. Seroprevalence is something that changes over time as the disease becomes more prevalent in a population. And so as we continue to study the disease process, we hope to better understand that. But the short answer is we don't have a solid number right now. We know a positivity rate, which is the rate that's publicly reported on the dashboard. But that is exactly the reason why we're here, and that's exactly the question behind the question that we seek to answer. So thank you.
Is it, I guess to expand, is it, do you want these people to have the antibodies, or you don't, because that means that they have fought the virus?
We need to know is the other way I would answer your questions. We really need to know exactly how common it is for people to have antibodies. One of the challenges with COVID-19 in particular is the fact of this notion of asymptomatic spread, which you've all heard about. And the challenge with asymptomatic spread is people feel fine, or maybe they thought they had the sniffles or their seasonal allergies, and for some, that was how they manifested COVID. For others, tragically, it's much more severe. So understanding how this disease process plays out in a community, in any community, certainly ours here in Howard County, is exactly essential to what we're doing.
So a person can have the antibodies even if they haven't had the virus or come in contact with the virus?
Well, to clarify, someone who has antibodies at this point in time means that they've had an immune response to the virus. And until immunization and vaccination is widespread, we treat that individual with positive antibodies as if they've previously had COVID-19. The challenge is they may not even have been aware that they've had it. So, fantastic questions.
This might be a question for someone else, but what is the timeline on this, and when might testing be available to Howard County residents?
Thank you. The question is, what is the timeline for this overall effort, and when may this be available to residents? So as you heard today, we have almost completed our emergency responder with a portion of this effort, which is testing more than 1/3 of our emergency responder population, or nearly 600 people. That's the first phase. We then are going to open it up to the 3,000 county government employees in the next coming weeks to culminate prior to the end of the year. Lastly, the Applied Physics Lab has done such a good job at partnering with us, and so they are currently in the design phase of a larger population study. We hope to be able to continue this with additional funding through other federal funds, but at least for now we are working on the design of that overall population effort, so we can hope to launch that in 2021.
Who is paying for the testing of the county personnel? Is the county picking up the bill for that, or is that federal money?
That's a great question. The question is who is paying for these tests? We have a partnership with Quest Labs so that any employee with insurance can go to a Quest Lab location in Maryland and get that test. We will also be able to use CARES funding to reimburse where insurance is not covered.
Will there be a cost to the general population once those tests are made available?
Will there be a cost to the general population? Excellent question, and this is why we are really looking to the federal government to be able to open it up so that anyone can have access to such important information. Any other questions?
What specifically is, I know this is going to be used to generate a lot of data about this spread in the community, but what specifically is that going to help with? Is it going to help develop treatments or prevention, or what specifically is it going to be used for?
That's a great question. Dr. Levy can start with that answer, and we also have Sheri Lewis from the Applied Physics Lab. The question is what really will we hope that this data will show? Dr. Levy?
So I'll answer that question from the perspective of our public safety and emergency response personnel, and then I'll defer to my colleagues if they want to add anything to that. The understanding the prevalence and understanding how common it is to have antibodies for COVID-19 at this moment in time, here we are somewhat 8 months plus into the pandemic, helps give us an idea as to how well our practices have worked, which, as you've heard today, we feel they've worked very well, both from PPE, but also from infection control policies and guidance, policies related to quarantine and isolation, and everything that it takes to operate and maintain and sustain operations, everything you see behind me, through an infectious disease emergency like we're dealing with. So where do we go from that? We will continue to monitor this. We continue to use this information now as a snapshot moment in time to tell us what we've done so far, we believe has worked safely and effectively to keep our personnel healthy, and that we will be able to continue as we look towards crafting new policies or adjusting course as necessary to use data to inform those decisions. It's a great question, and I'll defer to any of my colleagues if they'd like to answer anything else.
So I'll just add that from a public health standpoint, any kind of data that we can have to understand what's going on in the community is really key in order to help make decisions. Right now, we're in a very novel time. We don't know a lot about coronavirus, this particular one. And so any understanding that we can gain of what's going on in the community just helps have more information to make decisions, to understand how prevalent it has been in the community. So again, we're still in the design, the very beginning of the study design phase. But really that's what the aim is really for that general situational awareness or understanding of the health of the community.
How are you guys going about designing this larger population study? What goes into that, and what are you guys doing at this point to make sure that runs smoothly?
So the question is what is going into the design of the study? So really right now we're at the very beginning of it. Really it's just starting to understand some of the more information about the demographics of the population of the county to begin with, mobility trends, things of that nature. So really that's the very start of it, is all of that data and information goes into developing the models to help understand the spread of the disease. Thank you.
Any estimate on when it might be available to county residents? Sometime in 2021, but are we talking months? Are we talking a year?
Thank you. The question was reiterated on when can we expect to see this for other residents. And to clarify, today, if a person has a doctor's order to get a serology test, they can go. What we want to do is a concentrated effort in partnership with the Applied Physics Lab under the banner of a study for the purposes of contributing to science and understanding holistically where Howard County government is. We also understand that the Red Cross has an effort regarding testing to see antibody prevalence, and so we are right now in talks with them to better understand what data that they have to date, so this can be a full holistic effort.
Why is this happening in Howard County? Is it being used as a guinea pig study for the rest of the state?
That's a great question, is why Howard County? The way I would answer that is right now there is a Maryland Department of Health overall effort regarding first responders. Howard County did take, under the banner of and direction of our county executive, we wanted to push this and open this up to provide the access to our employees and also have an innovative approach to really look at our population and contribute to science. Are there any other questions? Okay, thank you very much for those tuning in on Facebook, and we appreciate you all for your interest in today's press conference, and that concludes our press conference today. Thank you.